It feels as though every day brings another public health crisis. Hi, this is Dr. Howard Zirk at the Doc in Docology. Ebola is back in the headlines. The World Health Organization has declared the current Ebola outbreak in the Democratic Republic of the Congo, DRC, and neighboring Uganda a public health emergency of international concern. This is a designation reserved for serious global health threats. So here's the situation in brief. The outbreak is centered in eastern DRC, a region that has experienced Ebola outbreaks before, but is also dealing with ongoing conflict and instability, making it extremely difficult for public health workers to safely reach affected communities, trace contacts, and contain the spread. Now, the current report suggests there may already be more than 350 suspected and confirmed cases and over 85 deaths. Cases have also been identified in Kampala, that is the capital of Uganda, which is the neighboring country, raising concerns about broader regional spread. Importantly, this outbreak may have been smoldering for weeks before it was formally recognized. WHO was officially notified in early May, but reports indicate that at least one death, potentially linked to Ebola, occurred in late April. This outbreak involves the Bundibujo strain of Ebola. I think I pronounced that correctly. A strain for which there is currently no approved vaccine. Now, Ebola is a severe viral hemorrhagic fever that can initially resemble many common illnesses, with symptoms including fever, headache, sore throat, muscle aches, vomiting, diarrhea. Sounds like the flu. But in severe cases, patients can develop internal and external bleeding, organ failure, and shock. And depending on the strain and the setting, mortality rates can approach 50%. But let's address the question everyone is asking. Is this headed to the United States? At this point, it is extremely unlikely that the United States would experience anything resembling what is occurring in Africa. Essentially zero. Ebola spreads very differently from that of COVID or influenza. It generally requires direct contact with the bodily fluids of someone who is symptomatic, obviously infected. Healthcare workers in these settings are at greatest risk. This is not the result of airborne spread like COVID, flu, measles, and many other respiratory diseases. Could an isolated case appear in the United States from an infected traveler? Well, yes, that is possible in an interconnected world. And that did happen in 2014. Now, reports indicate that several Americans in the region may have been exposed to this current outbreak, and U.S. public health officials are actively coordinating monitoring and transport efforts, possibly to Europe, according to what I've been reading about. Public health officials are also carefully watching travel patterns. Now, while travelers from DRC and Uganda enter the United States each day, and what I hear is about 150, nearly all arrive through connecting international hubs where screening and monitoring protocols can be implemented if necessary. I had the opportunity to meet with the public health leadership of the DRC when I served as Deputy Director for Global Health at the CDC. These are experienced, dedicated professionals working under extraordinarily difficult conditions. They work alongside WHO, Africa CDC, and international partners to stop this outbreak. And our CDC in Atlanta have incredible Ebola experts, and they are on the case. Many of us also remember the Ebola crisis in 2014. At that time, I was New York State Health Commissioner, and every day was focused on preparedness, ensuring hospitals, healthcare workers, emergency responders, and the public were ready if cases appeared in the United States. And New York did have one case of a returning doctor from West Africa, and that experience taught us an important lesson. Preparation matters, communication matters, and strong public health systems matter. Now, I will continue to follow this outbreak closely. I'll keep you updated as the situation evolves. Oh, and a quick update on the hantavirus situation. At this point, there have been 12 confirmed or presumed cases linked to the cruise ship outbreak, and and there have been unfortunately 3 deaths. 18 Americans returned to the United States after the outbreak aboard the ship, and most are being monitored in Nebraska, which is the home of the National Quarantine Unit, which is one of the country's leading biocontainment facilities. 2 others were transferred to a similar high-level biocontainment center at Emory University in Atlanta. In addition, public health officials are monitoring individuals in at least 5 states for possible exposure because they were on flights where there were passengers who were on those flights as well, and those passengers had been on the cruise ship. Well, I will speak to you soon, and hopefully it will not be about another public health crisis.